Hi, good afternoon, everybody. Welcome to Juliet Fowler Communities. I am Tammy Oliver, and I work in community relations here at Fowler. For those of you new to our community, welcome. We are a senior retirement community in the East Dallas Lakewood area. We have all levels of living. We have independent senior apartments, assisted living, memory care, full nursing, short-term rehab, and our affordable housing at Fowler Christian Apartments. We're thrilled that you're here. We are hoping that you are all staying safe out there. We miss seeing your faces, but we're glad that you are joining us today. If I could ever help you out with any of your senior living needs or questions, please feel free to give me a call. I'm here to help in any way that I can. A couple of housekeeping details today. You are all on viewer mode, so your cameras and your microphones are off. You can see us, but we cannot see you. So if you have questions, Jeryn will be monitoring those. And at the end of her presentation, she's going to be answering some of those questions. So just type those in and during the in the chat forum, and she can grab those. So today we are thrilled to have Jeryn Laengrich once again. She has done this for us for several years, and she is wonderful. She's a great expert in Medicare updates. So today it's Medicare 2021, what all is up with going on there. Let me tell you a little bit about Jeryn. After graduating with a Master's of Science in Speech Language Pathology, Jeryn began as a therapist and moved into multiple leadership and executive positions throughout healthcare. Jeryn has witnessed and experienced firsthand how life's challenges prepare us for the next adventure. In her mid-30s, she found herself caring for a parent and small children at the same time. Her caregiving role did not stop. It continues even today, just a different person. Learning is a passion for Jeryn, and her purpose is to help others understand and prepare for healthcare changes that affect each of us and generations to come. Jeryn is currently the Director of Network Operations for OneShare Health. So, Jeryn, let's see if we can get you on the screen here. There she is. Hi there. Welcome.
Well, I'm glad to be here. It's ditto. We usually do this in person, but we're going to do this virtually, right? So hopefully I'll be just as animated over video as I am in person. So I decided to come up with something bright and cheery today. And I think I may actually see my mother as one of the attendees here. So Mom, if I tell stories on you, you'll just have to forgive me. What I'm going to do is I am going to put up a presentation. If you give me just a second, I am going to share my presentation with you all. So, and hopefully you'll still be able to see me. And I will still use my hands as I talk, whether it's on a video or not. So before we get started, I want to thank Juliet Fowler Communities, Tammy, and the team for having me back again. We're just back in a different way this year for 2020. But what I'm going to talk about is Medicare 2021. There's been a lot of changes, and it was really a lot of fun for me to put this together because I always like to keep up with what's going on. One of the things that I will not discuss or talk about is political issues. So if this is just the facts, this is all we're going to talk about is the facts. And I just want to get started. And again, if you'll put your comments in the chat feature, what I'll do is I will get to those, trying to leave time for sure at the end of the presentation to be able to go in and answer those questions. Usually we like to take questions live. Those that have seen me present before, that I usually like to do that, so there's clarification. But since this is kind of a new format for everyone watching, and I've done a few virtual presentations recently, but we'll hold them to the end. So hang on, because there's a lot to cover in a very short amount of time. And I do believe they're recording it. So if for some reason you missed it or you need to go back, you can also always get in touch with Tammy or the team. And if you've got questions, I'm happy to take those questions via email after. So let's get things started. Well, hang on, technology. I'm going to try something different because I was going to try and be all fancy and had my clicker ready, and the clicker decided not to work. So, that's just the way it is. But what I want to do is talk about open enrollment. Open enrollment really is where you can start comparing coverage. Open enrollment begins the 15th, so in just a day or so, and goes through December the 7th. This is the time that you want to look. If you're happy with everything, I always say if you're happy, don't make a change. But this is the time to also be looking primarily, if you're on original Medicare, to look at maybe some of the drug coverage. If you've had drugs, if you've had medication that your doctor has added, now's the time to shop around for different drug plans. Your new coverage won't begin, obviously, until January the 1st. This period does not have to do with if you are a new retiree. You have your own enrollment period, 3 months before, 3 months after your 65th birthday. This is specifically if you want to make changes. The other thing that has changed a little bit, not a whole lot, beginning in January, from January 1st to March 31st, if you're on a Medicare Advantage plan, say Humana, Gold, or AARP Medicare Complete, they're now allowing you to make one change during that period if you want to change your Medicare Advantage plan, even though you signed up during this time. So think about it. That's when you could make the change now, but if you decide this Medicare Advantage isn't for me, you've got an opportunity to make that change January 1 through March 31st. Again, that is only for Medicare Advantage plans. So who really has to sign up for Medicare Part A and Part B? Well, if you're close to 65, but you're not getting Social Security or railroad retirement benefits. So that's really who needs to sign up right now for Part A and Part B. It's not anybody that is currently on Medicare. You're already on it, whether it's Medicare Advantage, whether it's original Medicare. But 3 months before you turn 65, if we have anybody watching or for your friends that are about to turn 65 and have questions, then this would be the 3 months before would be when you would start deciding what you want to do. If you're still working, then you would just sign up for Medicare Part A because your coverage through your work is still going to be your primary coverage. So again, if you need to sign up, it's those turning 65. But again, that's 3 months before, and you got till 3 months after. This came up, and I decided to include this in my presentation because we have a lot of people that are retiring. My uncle, a few years ago, was in his 70s, and he'd been working. He had Medicare Part A, but he decided to go on COBRA because he wanted to keep his doctors. He didn't want to make any changes just then. Well, what happened is we all think, well, we've got COBRA, we've got what we call coverage, right? We do have coverage, but it's not what we call coverage based on current employment or credible coverage. So what you have to do if you're retiring and you want to stay on COBRA, or you've changed jobs and you want to stay on COBRA, but you're of Medicare age, you've got a very special enrollment period time where you have to get a Medicare Part B and a Medicare Part D drug plan, or choose a Medicare Advantage. So don't put it off. Don't think because I've got COBRA, I'm good until it runs out. You've got a very finite window of getting on Medicare, even if you have COBRA. So keep that in mind. That's always an important one. My uncle waited until when I figured it out. I called my aunt. She was driving to Fredericksburg, and I said, okay, Uncle Wayne's got to make sure COBRA doesn't count. He's got so many days. He's got to get it done. When did he retire? When did his insurance quit? So she told him. He even went to the Medicare and U book and looked and checked it out and still didn't believe us. And he went and sat at the Social Security office for a few hours. And then he signed up. But he did it within a couple of days needing. I also want to state, I have it at the end of the presentation, but I always like to remind everybody. Tammy says I'm an expert. I'm only an expert as far as my dad would say, An expert is a drip under pressure. And so really, I'm not sure I'm an expert other than I read and I like to keep up with what's going on with Medicare because I've got my mom and I've got my father-in-law and my stepmother-in-law and, people in my life that I like to keep up with what's going on in healthcare and what's going on with them and what some of the changes are. So the information that I'm presenting to you directly comes from Medicare and You. The booklet is now out for 2021. I have it saved always every year as a PDF on my computer. And I always tell everyone that if you don't know how to download a PDF, call your grandchildren because they'll be able to help you. So again, where I get my information is directly from Medicare and You. So any information here, I've even referenced a number of the pages in here this year as to where you can find the information. So what's new for 2021? Obviously, COVID. Coronavirus is, on the tops of everybody's mind. This is why we're coming to each other face-to-face this way versus face-to-face if I would be at Juliet Fowler. So Medicare's committed to getting you the information on COVID-19. So what they've asked for now and going forward, if you have questions about coverage through Medicare for COVID, Medicare Advantage, you would contact the insurer that carries your Medicare Advantage plan, but you need to reach out to Medicare. Call 1-800-MEDICARE or go visit their website. So that's always good to just make sure, when vaccines starting to come out, it will be good to go and just double check what Medicare is saying. Lowering out-of-pocket costs for insulin. If you join a Medicare drug plan that participates in the Part D senior saving model, that's on page 81. So if you've got your Medicare and You book, you can always go there. So the other thing is if you're on a Medicare Advantage and you have end-stage renal disease, you can join a Medicare Advantage now during this open enrollment. Used to, if you had end-stage renal disease, you would automatically revert to traditional Medicare. So that's something new for 2021. Those with end-stage renal disease can actually join a Medicare Advantage. That's something new beginning in 2021. But you've got to make the decisions now during open enrollment. So those would be some of the reasons that you would want to consider making changes or looking into the coverage that Medicare has. The other great thing is acupuncture. Medicare is now actually going to cover acupuncture for back pain, but it's only chronic low back pain. So if you need, so for mom, acupuncture, Medicare is still not going to pay for the acupuncture that you get to help you move unless you've got low back pain. So that's really great news because sometimes low back pain can be very debilitating. And as a therapist and having run rehabs, I know, back pain just can be very debilitating. So the good news is that Medicare is recognizing alternative treatments. So acupuncture is now going to be covered if you have chronic low back pain. So the other thing that's come out of COVID is telehealth and virtual services for telehealth benefits. At first, they were saying we're just going to do it for a very short period of time. Now, we don't have an end in sight. What we have found is that for a long time, Medicare said, no, you can only do televisits if you lived in a rural area, if you'd had a stroke and you couldn't get to the doctor. Well, unfortunately, many of you, and for myself, I can't go see my mom since she lives in assisted living, is many times it's very difficult to be able to go out and go see a doctor because then you might be quarantined or, but now Medicare will continue. We don't know how long how long it's going to be, will continue to pay for televisits. So that's great news. Just like we're coming to you via virtual, not your television, but on your computer, but virtually, now you can still have telehealth with your physician. So that's really great news. So don't put off your visits. Don't put off when things are ailing. Check with your providers just to make sure that they're set up to do telehealth, virtual services, because it's so important. Too oftentimes we want to say, well, I can't get to the doctor, so I'm just not going to go. And that sets us up and doesn't keep us as healthy and doesn't get us into the preventative care that we really need to in order to live a healthy life. So I just want to start with reminding everybody, especially if there's any kids watching me or watch me later on, Medicare doesn't pay to live at Juliet Fowler. Okay, I just want to clear that up. Medicare is your insurance, is your loved one's insurance. It's for medical issues. It does not pay for long-term care or what Medicare defines as custodial care. If I need somebody to help me get up and take a bath, get a bath, get my food, Medicare doesn't pay for that. I always like to remind everybody, if my insurance at work doesn't pay for the medical services that I need, Medicare generally will not pay for the services that you need. So always keep that in mind. Medicare is an insurance in the simplest terms. So I always like to take this from the Medicare and You book. You've got original Medicare over on one side and Medicare Advantage on the other. So if you get confused, go back to your Medicare and You book and look at it. So simply put, original Medicare, you have Part A, Part B, and then you have to get a drug plan. Medicare Advantage, most of those are combined all together in one plan. And what happens is an insurance company takes your Medicare dollars and they are the ones responsible for allocating them, paying the doctor, for paying, for the visits, paying for the televisits that you had, paying for the therapy that you've had, and the medication cost as well. So it's generally all lumped together as one, which we call sometimes Medicare Part C. So you might hear Medicare Advantage listed as Medicare Part C. So you've got original coverage of Medicare and again, Medicare Advantage. Most plans do include the drug. So don't forget about that when you're looking at a Medicare Advantage plan, that you also want to consider the drugs that are on that plan, just to make sure that they've got the formulary or the platform that will carry your drugs. So always look at that when considering Medicare Advantage or changing Medicare Advantage plan. So the little apple in the book, which I always like, when it has next to preventative services, it actually has a little apple. So you know that those are your preventative services that Medicare either covers at 100% or at least covers the 80%. So you've got your yearly wellness visit, you've got your screenings, and you've got your shots and vaccines. Now, I can't see hands, but you can always raise your hands or send me a chat. How many of you have actually gotten your flu shot yet? I did. How many of you have gotten maybe a pneumonia shot? I'm not quite old enough for that, but I am old enough for a shingle shot, even though I don't have Medicare. So how many of you have gotten the shots and the vaccines that you need? Don't put it off. Make sure, talk to the communities if you live in a community, if they're going to offer that, because that's just as important right now, because those are different kinds of viruses that go around. So don't put off the yearly visit, because that's how we stay well. Don't put off your screenings if you need to do your screenings, and don't for sure put off your shots and your vaccines. The other thing that Medicare is really focusing in on is mental health and substance disorder services. They now have, are covering treatments for alcohol misuse. There's an alcohol misuse and screening. And right now, we know mental health is being taxed in all of us. We're seeing higher rates of mental health issues because, many that are watching, or many of those have loved ones, haven't been able to get out. We're all struggling. And so oftentimes, how do we struggle? We cope. We use coping mechanisms like alcohol. But if you know someone that, needs screening for alcohol misuse, Medicare does have a screening and will pay for a screening for that. They now have, coverage for behavioral health integrated services like depression and mental health services, counseling for tobacco use or tobacco-caused diseases. And you'll notice in my presentation, I'm putting the pages directly from Medicare and You 2021 that you can find this. Another crisis that we see in the United States right now and all over is opioid use. Medicare now is covering for opioid use disorder treatment services. So if you know someone that has become addicted, that's why they've started paying for acupuncture, that low back pain, those chronic pain issues. People start taking these opioids and become dependent on these opioids. And we don't want that to happen, because getting off opioids, or it could interact with another medication that you have. It's so important to manage that. So Medicare is now covering opioid use treatment services. Again, telehealth, we've already talked about that. Prescription safety checks. There are drug management programs that Medicare will pay for, and they also have tips if prescribed opioids on what to use instead of opioids, or how to manage your opioid addiction. So don't feel like you have to be in a bubble or isolated if you're having some mental health issues during this time. We're all struggling. Know that Medicare is aware that Medicare, the federal government, the guidelines and everything are changing to also address not only our young with insurance, but also those of us that are getting older, because it comes more important with our mental health to make sure that we're taking care of it. So I always like to talk about becoming an informed consumer. That's really the way we drive down healthcare costs, is if we are an informed consumer. So starting in January 2021 for Medicare, hospitals are required to make public the standard charges for all their items and services, including charges negotiated by Medicare Advantage plans to help you make a more informed decision about your care. So I don't have a Medicare story directly to talk about this, but I can use our own insurance story, which is very similar. I needed to get a bone density test, a baseline. And we have a high deductible, so we have to pay a lot out of pocket before our insurance starts covering it. And my husband works for Lockheed Martin, and they give us some tools so we can look at pricing. And so my doctor said, hey, here, go to this place to get this bone density test. She knows them, great relationship, no problem. Well, I asked them, and I had services to be able to check their pricing through Lockheed Martin, and they wanted to charge me almost $300 for a bone density test. And I was like, oh, no, we have over $6,000 I have to pay out of pocket first. So I start looking. Same test, placed just around the corner from where I live, very nice imaging center. I got a bone density test for $39. So because I knew what the prices were if I had to pay for it out of pocket. Now, whether you have to pay for it out of pocket with Medicare, the law now requires that hospitals tell us what their standard charges are. Now, I worked for hospitals, done charge masters. I always say hospital accounting is funny money. So don't get a panic when you see that, they may charge you $1,000 for a box of Kleenexes. That may not actually be the actual charge, but at least you know. So if you need to go have a hip done, instead of going to a large hospital that's going to charge Medicare a lot of extra money because they have a lot more overhead, does your doctor go to a surgery center where they have just as good a care, where they can do it more efficiently, maybe not even keep you there longer, but it's actually overall going to be cheaper in the long run for what they charge Medicare? Maybe that's where, you need to go, because then you're an informed consumer. So I'm excited about knowing what, we're being what we're being charged for, why we're being charged it. And if you have things done in the hospital, hospitals are always going to charge more because they have more overhead. Don't get me wrong. I love hospitals. I've worked in them for years. We need them, but we also need to be an informed consumer. So this is also going to make healthcare more competitive as well, because a lot of times you can have the same and even better excellent care in different places, because this is what we're going to. We're going to value-based care. We're putting care back into healthcare, which makes me excited. So I'm just going to quickly run through original Medicare Part A. That covers inpatient care at the hospital, inpatient care at skilled nursing like Juliet Fowler on their Medicare unit for skilled nursing, hospice, and home health. The other thing is, when you're in a hospital, you need to ask am I an inpatient or am I an outpatient or am I an observation? Just because you spend the night in a bed in a hospital doesn't mean that you've actually been admitted to the hospital. And that could really make a difference as to whether how Medicare is billed. Is it going to be billed as Medicare Part A as a hospital admission, or would it be billed as an outpatient under Medicare Part B? You will incur more costs unless you have a Medigap, a supplement, secondary insurance if it's billed as Medicare Part B. So I always tell people, make sure, have I been admitted? And they tell you they can't tell, that computer sitting there in the room, they can always go in and look. But a doctor has to check the box or say yes, write an order that says this person has been actually admitted and not an observation or an outpatient. The other thing that happened a couple of years ago is always actually, you'll never forget this, I always just ask, did the hospital moon you? You can ask them, have you mooned me? That'll get their attention. But a moon is a Medicare outpatient observation notice. So within 24 hours, if you're there more than 24 hours, the hospital is required to provide Medicare and Medicare Advantage beneficiaries to tell you or your loved one that you're still an outpatient, or you've had critical access to a hospital, because that moon will show and help you know how it's going to be billed and how it will be paid. Skilled nursing, as I said, is covered under your Medicare Part A, but under the skilled nursing bucket of days. So if it's original Medicare, we've got a few exceptions we're going to get to in just a second. You have to have a 3-day minimum hospital admission, not observation, but admission. So that's why it's so important to ask, have I been admitted or am I an outpatient? Now, if you're on a Medicare Advantage plan, say Humana Gold or AARP Medicare Complete, you may not need that 3-day hospitalization. So, you want to double check that plan. So instead of having to go to a hospital, you may be able to go directly to a skilled nursing facility that accepts that plan. If your doctor participates in accountable care organizations, Baylor has one, Texas Health has one. If you're around the country watching this, in your area, I promise you the large healthcare systems have what we call accountable care organizations. You may also not need that 3 midnight stay. They have a waiver. And so that's where we need to communicate with the case manager or the social worker at the hospital. So again, traditional Medicare, you have to have a 3 midnight stay unless you have traditional Medicare and your doctor participates in accountable care organization or you have a Medicare Advantage plan. So if you need help, like with Juliet Fowler, check, give them a call, ask, and they'll be able to walk you through that. Hospice care. Now, hospice, the only person or the only individual or being that can tell us if we're going to live for 6 months is God. So just because you have a diagnosis that says you may or may not, you may live only 6 months or less, again, that will qualify you for hospice, but doesn't mean that you have to have passed your loved one or you have to pass away in 6 months. You can always be recertified for it, but again, the doctor must certify that an individual is terminally ill. So what does it cover? And I think this is where hospice, we have to realize that hospice is really a great service for those of us that are at the end of life, because it not just provides care to the individual, but it provides support to the family. And that's what I love about it. So what covers it? All the items related to pain relief and symptom management, medical nursing, social service, medications related to why you're on hospice, and definitely some certain durable medical equipment. Now, if you're in a place like Juliet Fowler and you need to be in their nursing part of their facility, Medicare won't pay for room and board, but it'll pay for the extra services that you're getting. So I think that's where the confusion comes in. It's like, well, I'm on hospice, so it's going to take care of where I'm staying. It does not, unless you're in a designated, what we call general inpatient hospice center, where it's only going to be 7 to 10 days. So again, the hospice, we just really need to think about utilizing it more instead of waiting longer toward the end of life, because there is so much more support that can be provided to each person. So Medicare Part B, we're talking again about the original. What it is that it's usually what we consider outpatient, things that happen outside the walls of a hospital, a skilled facility, or outside of your home. So doctor services, outpatient care, therapy. There's a lot of preventative services that are covered under Medicare Part B. They're even covered at 100%. So I really encourage everyone to go download it, to go grab the Medicare and U book. Usually I take one of my mom's, but since I can't see her, I didn't take hers. I just downloaded it as a PDF. Go and double check what it is. Telehealth. So I included this. We talked a little bit about it, but I just wanted to make sure that as of August, that Medicare, like I discussed earlier, is waiving all the reasons to use telehealth they had before. You had to live way out in the country. You couldn't get to a doctor if you only had a stroke. But one of the other great things that just happened in August, as a result, a broader range of practitioners, such as physical therapists, occupational therapists, and speech language pathologists, now can use telehealth to provide Medicare services. So we were all sitting on pins and needles for the last few months waiting as therapists to be able to provide you all services. So excited to see that now they've opened it up broader. So what does traditional Medicare, as we call it, Part A and Part B, what doesn't it cover? That's one of the challenges, and that's why a lot of people join Medicare Advantages, because they want the advantage, that extra coverage. But traditional Medicare doesn't cover most of your dental care unless it's related to a medical issue. Eye exams, denture, cosmetic surgery, massage therapy. Now remember, it does cover acupuncture for low back. Routine physical exams. It will cover 100% your wellness, but again, you have to look at what kind of physical exams. It'll cover 80% generally, and again, long-term care. The other thing that comes up recently is concierge medicine. Say, hey, my doctor's not going to take Medicare anymore. It's not going to take any insurance anymore. They're joining a concierge practice, or they're becoming concierge. That's awesome. You pay a fee to have their cell phone number. But also you have to understand that covered items or services you get from a doctor that has opted out of Medicare or other providers, except in the instance of emergency or urgent care, Medicare is not going to cover that. So it's great if you want to keep your doctor and keep paying your fee, but know that Medicare is not going to cover those services. And there are some challenges when an emergency comes up or you're admitted into the hospital, because your doctor, they could still come see you if they have privileges at that hospital, but they may not be able to treat you, and Medicare's not going to pay for their services. It's going to pay for the services of the physician and the providers that are treating you if it's emergent or urgent. So Medicare Advantage, or Part C, as sometimes we like to call it, again, it is a combination of Medicare Part A and Part B, includes most drug plans, does have some extra benefits, but each one you have to look at individually to see what the extra benefits are. There has been some discussion around the country. Last year they did it where some of the Medicare Advantage would provide non-medical home care. Have not seen yet this year if any in the South are going to provide that. Most of them were up north. Anthem, the coverage through Anthem, Blue Cross Blue Shield, up in the north did provide some of these. I've not seen any currently offering non-medical, like caregivers, sitters, where they were providing that as part of it. Stay tuned, stay alert. There may be some changes. That's Medicare Advantage, not traditional Medicare. That would again be custodial care. So at the end of the year, you may have gotten an annual notice of change. Those should be coming out now if you haven't already gotten it. So if there's any changes to your Medicare Advantage coverage, then they're going to send you a notice. So pay attention, because that may make a difference during this open enrollment period where you want to change and maybe shop around. Different types of Medicare Advantage plans. You got your HMOs and your medical savings account. You don't see those as much very often. PPOs, private fee for service. The two most popular are HMOs and PPOs. If you're a teacher, Texas retirement teacher watching this, that is completely different. They do have a Medicare Advantage plan that they administer through TRS. I haven't looked this year to see what major changes they're going to make, but if you opt out, just like my mom did, the city of Dallas last year, and I literally spent 3 hours on the phone trying to get all this sorted out. We're going to have retirees join a Medicare Advantage plan. Well, for mom, it was better for her to stay on traditional Medicare and just pay her premiums for her supplement or her Medigap and get a Medicare Part D plan. But what happened is that if we opted out of what the city was going to offer us, which was going to be a Medicare Advantage plan, then we can never enroll back in that plan. Same with Texas teacher retirement. Once you opt out, you can't go back. And, you know, sometimes it's okay. But again, this is the time to start making those evaluations, looking at that. So I talk about supplemental or Medigap. They're really Medigap, unless, you know, you're a retiree. Say you retired from TI. TI would have its retiree insurance as a secondary insurance or a supplement to Medicare. They have different rules. They have different coverage. You may still have to have a premium and an out-of-pocket and a deductible that's met before it picks up anything. But what I'm talking about is Medigap, Medicare supplements. You know, last year, Plan C and F, and many of you watching I know are on Plan F. F didn't go away. They just don't sell it anymore. Medigap Plan C and F, they're not being discontinued, but you've just been grandfathered in. Plan F and G now have a high deductible plan option. So if you want to pay more out of pocket to lower your cost of your Medigap, you can do that. If you have a retiree coverage, again, it is not the same as a Medigap plan, but it usually fills a lot of Medicare's gaps. So you always want to check and double check it. So Medigap sold to people who are new to Medicare aren't allowed to cover the Part B deductible. So that was what happened with Plan F is that it covered your Part B deductible. That one, as of last year, that can no longer be a part. That's why those plans were quote unquote discontinued, because now the Medigap plans can't cover those deductibles. So if you have a C or an F, don't worry, it didn't go away. So ignore the myths that are out there that it's gone. It's not. You still have it. Now it's Plan G, and it just doesn't cover your Medicare Part B deductible. You know, all but 3 states, the Medigap plans have to have the same type of coverage based on their letter. So A, if I bought it in a Medigap in Texas and I got a Medigap Plan A, it's going to be the same as if I went to Oklahoma. 2 or 3 states, it's not the same, but for this presentation, I always like to just be consistent. So you'll see F and G. This was out-of-pocket limits have not been released for 2021. This is still out-of-pocket limits for 2020. So as you can see, F was still covering the Part B deductible. Plan G no longer, and Plan F was faded out. Don't worry, if you've got Plan F, it didn't go away. So the good news is 2020, guess what? The donut hole went away. So, you know, but so that makes talking to you about Medicare Part D, unless this is not if you're on an Advantage plan, this actually makes it a lot easier to discuss. You got a yearly deductible. That's the amount that you have to pay before your plan shares any of the cover of the cost of the drugs. Some plans don't even have a deductible. So again, this is where you can shop around. Co-payments or insurance, that's the amount you pay for the drugs after you've met your deductible. Now, if you don't have a deductible, then you'll go into immediately to the payments or co-insurance. And each amount's going to vary based on at any time. It could be different due to the drug cost, especially on co-payments and co-insurance, and what tier the drug is on. So the higher tier, you know, more expensive. So, you know, double check your formularies, double check those, because you want to check your medications every year to make sure they're still on those drug formularies of your Medicare Part D. If you need to shop around, You can always go to Medicare.gov and plug in the medications. That'll pull up plans in your area. You can shop and look and see and do comparison. If you're getting out, you can still go to your pharmacy and have your pharmacist pull up different plans that they offer, and to make sure that all your medications are on there. So Part D, here it is. It's pretty simple. Most plans are $4,130 after your deductible and out-of-pocket amount. So that's a combined spending. You and your plan spend that much. You do, the plan does together, including deductible. Means you pay no more than 25% of the cost for the prescription drug until your out-of-pocket, complete out-of-pocket of $65.50 is met. So once you get the $65.50 out-of-pocket, after paying 25% of the cost of that medication, then you fall into the catastrophic coverage. So when you reach that, you automatically get the catastrophic coverage. We used to call it, it was after the donut hole. The donut hole's gone. You'll pay no more than 5% of the cost of covered drugs for the rest of the year. Now, you've already had to pay out of pocket the $65.50 in order to get to that. And many times by this time of year, many people have reached that. Once you've reached that amount out of pocket, you won't pay more than 5% of the cost of any of the drugs. So at this time of presentation, the premiums have not been released prior to this participation. So keep an eye out. They usually come out the end of October, the 1st of November. These are just some of the things to think about. And I got this from the Medicare Resource Center. It's a great website that they're going to try and limit the increase on the Part B premiums. Again, those haven't been released yet. So there's a bill right now, federal spending bill, that's trying to keep those premiums down. There is a chance that it still will increase. They're projecting to about $198. Now, your Part B premiums and your Part D premiums, or primarily your Part B premiums are based on your income from 2 years ago. So don't forget that. There is going to be some changes with the premiums, deductibles, and coinsurance. They could be a little bit higher. We still don't know. Again, plans C and F are no longer available to purchase. You get income brackets. It is Part B and Part D. As far as what you're going to pay a higher premium if your income is higher. So don't be sticker shocked if you've got a lot of income from 2 years ago. We expect, and the projection is, more people are going to continue to enroll in Medicare Advantage. The maximum out-of-pocket limit for Medicare Advantage is going up. It used to be about $6,800. It's going up, that you're going to have to spend, and different plans do it different ways. Some of them are smaller, but the maximum out-of-pocket that a Medicare Advantage can require you to pay, they're projecting it to be $7,550. So remember, if you have a Medicare Advantage, you go in the hospital, there's a chance you will have to pay up to $7,550 before then it's covered at 100%. And then the donut hole no longer exists. It took us years to get there. So as I close out, I just want to remind you that my resources, me being an expert, is not being me an expert. It's just me taking the time. And that's how we all need to be, is to be an educated consumer, is to make sure that, that we pay attention to what the plan has, what Medicare says, what changes are happening. There's been a lot of changes this year, a lot for the good. And so, they're listening, they're adapting to what's going on with the times. And I find that exciting. And it can be a little frustrating because of where we are with the times. But also use the book, use the Medicare and You 2021, Medicare Rights Center. It's a nonprofit, nonpartisan for information in the Medicare Resource Center. Those are always great places to go to keep yourself to being an informed consumer. So what I want to do is I'm going to stop sharing my screen and see if I have any chats from anyone. If anybody has any questions, I want to spend some time just taking questions right now. There should be a little chat box at the bottom of your screen that if you have any questions, I don't see any yet, I see the chat that I put in there that said I was on. But if anybody has any questions, I see our attendees here. Is that my friend Elaine that's here? Elaine, send me a message and say hi if that's you. But if you have any questions, please feel free. I'm going to be here for a few more minutes to just answer your questions, and just to remind you to, make sure you pick up the book. Make sure you pick up and you take the time to read. Become an informed consumer. Next year, if you have to have a procedure done and you've got Medicare, ask the hospital what it's going to cost. What are they going to charge? Because that's the way that we can make the best decisions for us. You can even ask your doctor. Even though they're not necessarily mandated to do that, you can actually ask your doctor, what's this going to cost me out of pocket if I had to pay out of pocket? So make sure. But I want to thank you. If nobody has any questions today, what I'd like to do is, again, Tammy has asked me to close. Oh, wait, here's where can we access hospitals required to disclose for standard charges? You need to talk to the hospital. That becomes a law. All hospitals are to disclose that beginning in January of 2021. So what you need to do is you can reach out to the hospital. Generally, all hospitals are going to be required to do that. What I would recommend is, if you have to have a procedure in there, you might want to contact their billing office. That would be the best place to find out where you can get what they can disclose what they're going to disclose as standard charges. So every hospital by law is supposed to do that come January. Any other questions? That was a great question. So if anybody's got any other questions, please type them in here. We've got a couple more minutes. But again, I want to thank Juliet Fowler for having me back in a different format this year, but this has been fun. I do like to have an interaction with the audience, but sometimes, I just pretend I can see you smiling and nodding and try to anticipate some of the questions that might be being asked. If you do have any questions, Tammy has my email. I'm happy to have you email me, ask questions, see if I can direct you in the right direction. Everybody stay safe. Everybody stay healthy. And thank you again for having me. Thank you again for taking time to participate. Someone did ask if they could get a copy of my PowerPoint. They did record this. I usually don't share the PowerPoint. What I would encourage you to do is, all the information from my PowerPoint is in the Medicare and You 2021. So everything that I took out of here, the article from the Medicare resources, is directly out of Medicare and You 2021. But I believe they've recorded this today. And so you'll be able to see me again. If you're just really bored and you can't remember anything, you can always watch it again. But I want to again thank Tammy, thank the Juliet Fowler team for all that they do for the community. Be sure and reach out. I know they're going to, I was the first person to do a virtual presentation for them. So I hope we're going to see more from Juliet Fowler. They have done an awesome job with communicating with their community and with community at large as far as transparency goes during this time. And I want to personally thank them for that transparency, and for always being a good partner with me, and for being a good partner in the Dallas community and the Lakewood community especially. So without further ado, I'm just going to tell you all to have a great week. Enjoy the beautiful weather if you're here in Texas, and we will see you soon.